Welcome to the Think Factory podcast. We got one question for you. What keeps you up at night?
Hello and welcome to the Think Factory and the Women's Roundtable, where we learn how women think big and grow their business. My name is Susan Kleiner. I'm a partner with Outside General Counsel Solutions, and I'm the host of today's episode. I'm happy to have here with me today Maria Rodriguez. She's the founder of Care Counseling Center in Somerville, New Jersey. Maria is an accomplished mental health professional and is passionate about the mental health and wellness of children and families. Dr. Rodriguez has a long list of academic credentials, including 17 years as a college professor. She's served as an expert and consultant with USA Today and all the major news networks. She's earned accolades and awards for her outstanding research. And if that weren't enough, in January 2025, in her free time, she wrote and published her book, From Chaos to Clarity. So welcome, Dr. Rodriguez. We're so happy to have you here with us today.
Good morning. Thank you, Susan, for having me. It's an honor to be here with you.
Yeah. So first, before we get to talking about your book, let's talk about the Care Counseling Center, what it is that you do and why you founded it.
So at Care Counseling Center, we provide compassionate and culturally responsive mental health support, especially for immigrant individuals, children, and families. And I founded the center because of my own challenges and experience when I was growing up. When I transitioned from the Dominican Republic to the United States and those difficulties, also not finding a lot of people that look like me. And I wanted people to have a safe space that they can have someone to talk to and relate to someone who has gone through what they've gone through.
So when you said before culturally responsive, I'd love to hear a little bit more about that. Why is that important with, mental health, especially when working with children and families?
So language, for example, is a big deal. There are certain things that you cannot translate to English, for instance, or we lose in translation when we are speaking a different language. So having that connection that people can talk in their language makes a big difference. So also, in terms of cultural awareness, there are certain things that in other countries, Latin American countries, that are just different from the US. So having that perspective, having that knowledge really helps connect, and the person feels understood.
I would imagine too that it makes it a little bit easier for people to get the care that they need. Obviously, there's always, even still, some stigma with mental health care. And I assume that, being able to speak someone's language and meet them at their level helps strip away some of the stigma and strip away some of the barriers to care.
Yes, it definitely does. I know Hispanic families, a lot of them are hesitant to look for counseling because we've grown up thinking mental health is for crazy people. So having someone who has gone through what you've gone through and see that they're not crazy, that they're professionals and that they have gone through and made it through, and that there is a light at the end of the tunnel. People can see, oh, okay, well, it's not that I'm crazy. It's just that we all need at one point guidance.
100%. So now you don't work alone for the Care Counseling Center. How many people do you have working with you?
I have 10 other counselors on staff at the moment.
And do you primarily, tell me a little bit more about your work. Do you see people in the office? Do you go out to their homes? How does it work?
So we have different services. We have one service that is in-home, and that is through Perform Care. So if anyone wants to ever use it, they have to call. It's an 1-800 number, and it's actually free for anyone between the ages of 3 to 21. And a clinical provider will go out, a case manager will go out to the home, they'll do an assessment, and then they'll call us to see if we have availability. Then the therapist will say yes or no, and they will provide the services in the home for 8 weeks. It's kind of like an emergency service for families who are going through something difficult. Now, if let's say that it's not resolved within the 8 weeks, we can transition to a CMO agency, and that stays open for 6 months to 12 months. So another service that we have is in the individual counseling in the office. That could be group therapy, also family therapy, and counseling for children. And then we have the immigration specific services, which focuses on clinical evaluations for immigrant families who are working on their status.
So obviously, COVID and the challenges of COVID were very difficult for you as other mental health providers. I would think so, even more so as, the people that you work with were going into people's homes. Is that right? That it was hard to offer the services?
Yeah, so at that time, it became okay to do telehealth. So telehealth became very popular. I appreciate telehealth, but when you're in person, it's just a different connection. So even though telehealth was very helpful, I actually like that one-on-one, in-person connection.
And so
But we
now
still do with that. The telehealth is still available for the people who enjoy that.
it's good. So it's some combination, I guess, easier in some ways to bring the counseling, and the care needed to them. And obviously, with today's political climate, I would say that it's got to be pretty stressful for a lot of your your children and families, within the system. I don't know if you want to comment on that or what that's been like.
Funny you mentioned that, because I have seen an increase in requests for telehealth. Because people right now are afraid, if they're working on their residency or permanency here in the US, they're afraid to leave their home. So they have been calling asking, well, can we just do it over the phone or over video? And I've noted people have stopped going to work or stopped doing certain activities that they used to do because they're afraid that they might get caught out there and be deported. So I have seen recently an increase in telehealth
So,
requests.
so I mean, you're doing the best you can to support families in this really difficult time.
It is very difficult. And again, not only the requests for telehealth have increased, but requests for services have, I think, maybe tripled, for kids and for parents. Kids hear what's going on, and they are terrified that their parents are going to get separated from their parents, or that they're going to go to school and they're going to come home to an empty home. So it's a very scary time for a lot of people.
Yeah, well, I really appreciate your talking about that, and being able to report, what it's been like for some of your clientele. I'm sure it's hard, and thank you for sharing that. So I'm curious, and I know a little bit from reading a little bit about your book and about your book, kind of your own journey and what brought you to mental health and mental wellness. But I wanted to know if you could speak to that a little bit, how it was that you started out on this career path.
How I started on my career path. Okay, so it, it's funny. When I was in college, I actually entered college as a nursing student. But there, when I was studying, I met several women who were amazing. One specific woman, she was teaching in the women's and gender studies. Another person was teaching in psychology. Through the combination of these professors, I learned the disadvantages that I have had, not only because I was a woman, but also because of my race. And in addition to the past trauma of divorce and the experience of domestic violence between my parents. So they inspired me to, not that they said you need to switch, but their life stories, in addition to my experience, that's what inspired me to switch into psychology.
So that really
So,
speaks,
yeah.
I mean, that speaks to so many things, like the power of your character and giving back, but also speaks to the importance of mentorship and of women helping other women. Well, not necessarily just women, but women, and reaching out and mentoring people. And it seems to me like these mentors that you had at an early age changed your whole life, correct?
Yes, I am very grateful for the women who I had across or throughout my life. I can even go back to when I was in eighth grade, Miss Felice. She pulled me over and said, "Hey, what high school are you going to go to?" Public high schools that were available were Eastside High School and Kennedy High School, right? And then we had Tech, which is a vocational school. But you went to Tech if you were a good student. So she asked me, what high school are you going to go to? My thought was, well, East Side, I guess. And if you know anything about Patterson, you know East Side, not that very good school. They even made a movie about East Side. Do you know the movie? I can't remember the
Is
name
it
of
Lean
it.
on Me? That movie, Lean on Me.
Lean on Me, yes.
Yeah.
She said, "Oh no, you can't go to that school." And she started writing letters of recommendation, contacted the tech, and next thing you know, I was enrolled at tech. So she made that big life change, and I don't know where I would be without all these women who made an impact.
That's
And that is one of the reasons why I founded the care counseling, because I definitely wanted to give back and be a role model to the young girls who might not know the opportunities that are out there.
that's so inspirational and important to give back as a mentor and speaks volumes about you and your character. So I just want to talk to for a second, for a few minutes about your book, From Chaos to Clarity. And that's available on Amazon. Is that correct?
Yes, Amazon, Barnes and Nobles, and other platforms.
So tell me a little bit about that book. How is it that you, a busy woman who's running, your own business, your own practice, how is it that you found the time to write a book, and what led you to writing this book?
So my parents divorced, right? And then I went through a divorce, and seeing the correlation on how s- I handled the divorce, I feel like I could have done a better job. My kids went through some emotional difficulties because my husband and I couldn't actually agree on many things. So I had to sit back and analyze how I can be a better mom, be a better person, and how I can give back to the community in terms of teaching them what I went through, and how we can adjust. Divorce is difficult, not only for the couple, but also for the children, especially when they stay stuck. So seeing my son, he's the oldest one, going through his emotional battles, and at one point he became so isolated because if I think at one point, if he said something to his dad, if he said something to me, he felt like it would be used against one another, be used against them, right? So I wanted to learn from more from that, wanted to teach others, because I had also gone through that myself, right? So eventually my son and I sat down also, and we talked about divorce, and I said, can you help me write this book? Because I want to know what you've gone through, and I want to know how to make things better, not just for us, but for other people. So he was actually a key writer on this too.
And how old is your son?
He's going to turn 15 now. In May. He will be 15. So when we started writing this book, maybe he was 13. Yeah.
He must be very proud, and you must be very proud of him, to be
Yes.
able to give back in that way. So, I'm curious, looking back, and obviously, you've done a lot of self-reflection, in your adult years, but I'm wondering if you could give advice to your younger self, what would you say?
So I would say that one of the key advice is that chaos is often a birthplace of transformation. Sometimes, we go through difficult times and we kind of get stuck and we think it's forever, but from that chaos, from that pain can come something great. You can build something amazing. And maybe that's what this book was about, that we're almost broken, but from that brokenness, something great was born, right? So we just need to reflect when we have some time, where's this pain coming from and what can I do with this pain and how can I change it and grow from it?
I heard somebody once describe to me, they said, you're not being buried, you're being planted. And that sounds kind of like what you're saying as well. Well, what do you have coming up? What are you looking forward to, career-wise or, with your book or anything else? Anything that you're looking forward to?
I would like to expand actually, I am trying to get licensed in North Carolina to perhaps expand in that area. So yeah, that's something that I'm looking forward to.
Well, that sounds great. So we like to ask everyone that appears on the Think Factory podcast this final question. We always ask our business leaders this. What keeps you up at night?
So I have kids. The youngest one is 5. And what keeps me up at night is that the moment we turn the light off, she needs water, she needs to use the bathroom. But I'm just kidding. So for me, it's always the question, am I doing enough? Enough as a parent, enough as a professional, as a person. And I think a lot of parents feel that this pressure to be everything to everyone. So I have learned to kind of reduce the load and perspective that I need to take care of myself first, and that way I have enough love to offer everybody else.
Thank you so much. I mean, your compassion, it seems to me like your business could be called, Compassionate Care Counseling Center with 4 C's instead of just the 3, because your
Oh, thank
compassion
you.
and your empathy speaks volumes. Where can people find you if they're looking to speak with you or find out some more about the service that you offer, or fellow attorneys? I know that you also have served as an expert witness. Where can they find information on you?
My website is carecounselingcenter.org. The email is info@carecounselingcenter.org.
And then they can find your book on Amazon or on Barnes and Noble, Chaos to
Yes.
Clarity, and look for your name as well. Well, I want to thank you so much, Dr. Rodriguez, for being here. I'm Susan Kleiner, and on behalf of our entire team at OGC Solutions and the Think Factory, we want to thank you for listening to today's episode. Be sure to check out our other Think Factory podcasts, where my colleagues talk to business leaders about industry trends and issues. Thanks so much for being here today.
Thank you. Thank you so much for having me here.